Hello, everyone. Just going to give a chance for everyone to kind of show up. All right, and you guys let me know if you can hear me okay. I want to make sure everybody can hear me and see me before we get started. Hello. Hi, Greg, RG. Yes. Hey, everybody. Good. Okay. Thank you, everybody, for responding. All right. So we're going to take just a couple minutes to let people kind of filter in. I see some of you have already started leaving some questions, and that's excellent. We are going to ask you just kind of as you file in, if you have any burning questions about the NCLEX, about NCLEX Bootcamp, or anything else like nursing school, NCLEX related, we are going to try to help you out as best we can. I've been in test prep for 10 years, in NCLEX prep specifically, and so I feel like I can try and answer any questions that come to you guys. So just kind of start leaving those in the comments. I see several of you have asked questions about what do I do when reviewing rationales, prioritizing, figuring out best action versus initial action. Very good. A couple repeat attempts. So we're just going to take a couple minutes, but want you guys, if there's something specifically that you are really hoping to have answered today, like what do you want to learn after you come away from today's YouTube Live? If you just want to leave that comment, and yeah, we'll go ahead and take just a second, collect some of your burning questions, and then we'll get started. Hi to you, Cheryl. Hello, Saba Abid. Dawn, Krubo, Miriam, hi everybody. Where are you guys joining us from? I see people kind of coming from everywhere, it looks like. Very good. Cheryl, you're a repeat test taker. I would not worry too much about being a repeat test taker. Bootcamp has helped lots of repeat test takers pass, even if it's their, third, fourth. I think somebody said here they're on their fourth attempt, and it is not unheard of. In fact, we hear all the time from our students that they pass after unsuccessfully tackling the NCLEX with other products. So we try to really be that game changer for you. So, all right, we got people from Dubai, Kenya, Maryland, Portland, Oregon. I want to visit there this summer, Krugo, before the summer's over. So, all right. Okay. I think we've got a good number of people here, so we'll go ahead and get started. So again, my name is Emily. I'm one of the co-creators here at NCLEX Bootcamp, and we have another of our creators moderating in the chat. So she's just going to kind of collect several of your comments to give us some things to talk about. So leave those there. And again, I've worked in NCLEX prep for about 10 years now. So I've been asked to answer every manner of question about the NCLEX. And yeah, we'll try and get to as many questions of yours that we can by the end of this today, and just kind of leave those questions in the chat as they pop up, and our moderator is going to pick a couple to highlight and bring out for my attention. So okay, first to get started. So this is a big burning question that we hear a lot from students is, how do I prepare for the NCLEX? Or more specifically, how do I get started? Because you guys have probably heard from your peers like, well, you need a content review and you need a question bank and you should write down all the rationales and you should do this and that. And so you guys have probably heard a lot of conflicting information about how to prepare for the NCLEX. And so we want to kind of help demystify some of that for you, with the biggest emphasis being on this point number one, that practice makes perfect. So this is kind of exemplified sometimes, like if you want to perfect your free throw in basketball, you don't go practice like dribbling the ball, or you don't practice running up and down the court. You need to practice doing the free throw. And so you want to make sure that your practice, when you're practicing to pass the NCLEX, what you need to do to pass the NCLEX is to know how to answer these critical thinking and clinical judgment questions really, really well. And you need to be really comfortable in your ability doing that, or at least have enough practice that you're comfortable being uncomfortable. And so that means you need to practice with questions that look as similar to the NCLEX as possible. And you guys have probably heard, if you heard about bootcamp from your peers or anybody else, that our questions, we try to make sure that they look more like the real test than any other question bank out there. And that's what we hear from students. And so that's what you want to do, is you want to get in that same mindset that you're going to be in the test, of knowing how to practice these complex questions that are at or above the passing level, or that difficulty level of passing or above on the NCLEX. And so we've got lots of questions for you to do that. But it's not that simple, right? Many of these question banks have 1,000, 1,500 plus items, and it's not as simple as just jumping in and start to generate random tests. Although if you have a good base of content, that might not also be a bad idea. But in order to help you get started, because just telling you to go practice items is not really going to help you know your first step to takes, we have the NCLEX Bootcamp study guide and a study schedule available on our website. So let me show you what we've got here for that. This is our homepage where you can kind of access all of the resources that NCLEX Bootcamp has for you, including our case studies, standalone questions, readiness exams, cheat sheets, and a strategy course. Either from our homepage in our resources tab, or here within the product under resources, we've got this study guide and study schedule available to you. And so this study guide is going to offer really kind of answering all of these questions about the NCLEX. What is it? When should I take it? Details on registration, if you should self-study or use a course. And so you're going to find that this answers a lot of your questions about your content review and your NCLEX prep in general. So that's a good place to get started. Also, within our resources page, we've got a study schedule. So this is literally, depending on whether you have 1, 2 months, 3 months to study, you can download these study schedules here. And this is going to walk you day by day through your study schedule, and has built-in days for review time and for taking your readiness assessments. So, of course, you would start by reading the study guide, and then we have some videos from our strategy course that talk about testing basics. This is going to answer some of the questions you guys had about what do I do with the rationales, what do I focus on, etc., how to approach cases. And then the first thing that we suggest that you guys do is take our readiness assessment. So in the NCLEX Bootcamp homepage, whenever you've taken one of our readiness exams, you can see here I have a low chance of passing. No, I'm just kidding. I just kind of clicked through these. But once you complete a readiness exam, you can actually go in here and review. You're told whether you have a low, borderline, high, or very high chance of passing. But when you're just getting started and you're taking your first readiness exam, the important thing is that you want to make sure you are focusing on your weak areas. And for me, that's maternal newborn health. No surprise there. I've worked with adults my whole life, so that's absolutely my weakest area. And so that will kind of let you see, oh, well, within these areas, that's my area that I really need to focus on the most. And then that will let you kind of create tests from just those specific subject areas. So that's my second tip for you, is in addition to just practicing, you've heard that practice makes perfect. Well, it's really true that perfect practice makes perfect. And so that means focusing your practice on the areas that you need the most help in. And that's going to be different for everybody. So, you're going to focus your practice areas on those subject areas that you have the most room for improvement. So, okay, as far as how to prepare, questions about how to prepare, I'm going to look for what questions that you guys have asked for us. And I saw someone said, what do I focus on when I'm reading the rationales? And that's a really good question. And I'm actually going to pull up a question here for you to kind of talk about that. Because you don't just want to answer questions mindlessly, right? Each question is made for you to learn something from not just the correct answer. So whether you get it right or wrong, you want to be able to let me make this a little bit bigger for you guys. So whether you get it right or wrong, there's a teaching point built into each one of these options. So let's say if I am, here we go. So I'm going to pick a question that I think you guys might be able to answer no matter what point. Okay, prioritization question. We know we love prioritization questions. Okay. So we've got telephone messages from clients. It would be a priority for the nurse to follow up with a client who either has this new single irregularly shaped mole, painful blisters on the trunk after starting phenytoin. We've got questions about a Mohs surgery procedure, or we've got an itchy rash after contacting poison ivy. And so this is kind of the practice. This is what you're practicing when you're engaging with our question bank is you are trying to practice being uncomfortable with the answer, thinking through what you already know, and trying to generate a solution and pick the best action. And so here, if I'm going to prioritize a client, does anybody want to venture a guess? I don't see anybody wants to guess yet. So what's a priority? So when we're looking for priority, we're looking for life-threatening issues of airway, breathing, circulation, things that pose an imminent risk to the client, things that are unexpected abnormals. All right, I've got some guesses for 1, 2, and 3. All right, nobody wants to guess 4, and I would agree with you. We don't need to select 4, but why? That's because that is an expected abnormal finding, right? And a rash is not a normal finding, but it's an expected abnormal finding after we contact poison ivy, right? So a new single irregularly shaped coin-sized mole. Those of you who guessed 1, that's concerning, right? This is definitely an abnormal finding. We know from your ABCDEs of lesions for what could indicate malignancy that bigger than a pencil head eraser, so coin-shaped is too big, and irregularly shaped. So this could be cancerous, but we don't know if that's the priority. So everybody, it seems, likes 2. So, okay, I am going to agree with you. I'm going to pick 2, and you can see 61% of our users got this correct because, yes, this is our life-threatening issue. But if those of you who didn't know why this might be concerning, maybe it didn't register for you that this was a cancerous lesion, maybe you also had questions about a Mohs surgery. You are looking for what can I learn from this in general. And so in our explanations, we're going to break down for you the correct answer, why it's concerning. So this is an indicator of Stevens-Johnson syndrome, and these are the medications that can cause it. So these are our anticonvulsants, antibiotics, and allopurinol. So our 3 kind of A's of Stevens-Johnson syndrome. So this can be a life-threatening shock problem. So that's going to be a priority. Now, you've been refreshed on what Stevens-Johnson syndrome looks like, what medications it causes. Here are our characteristics of a melanoma skin cancer, that ABCDE mnemonic, if you didn't recall it. So when you're going through your rationales, you're really looking to understand what was the big priority issue here, and what can I learn from each of these options? So whether you got it right or wrong, you want to spend really the same amount of time kind of digging into this. And if you are pressed for time, really just making sure that you understand what's in the key takeaway is the big thing. So we have distilled here for you, what is the big thing? If I remember nothing else from this question, what should I remember? And in this case, it's a new rash after starting phenytoin or any of the other anticonvulsants, allopurinol, or antibiotics. That should be a priority issue for you. So as you're reviewing the rationales, make sure you understand why you answered it correctly or incorrectly, what you were supposed to learn from each individual option, because there's something there for you to learn in every single option. And if nothing else, at least know you understand the key takeaway solid. So great question. Very good. All right, so we've got a question. How do I know who is the priority when we get a question for which patient to see first if there's no option for ABCs? So that is a really good question. And management of care, you guys know, is the big section on the NCLEX. That's where the bulk of your questions are that you're going to find most challenging. And so prioritization is a very tough topic, and it's a very important one to get right. So we have actually got several resources for you. So in addition to practicing prioritization questions in the bank, we've got our prioritization cheat sheet that you guys can now access. And for focused remediation, when we're talking about remediating your weak areas, reviewing your weak areas, our cheat sheets are an excellent way to do a topical review. And so if you guys hang out until the end of today's presentation, we're actually going to send a link so that you can download all of our cheat sheets for free. But just to give you a little sneak preview, let's take a look here at what they look like. So here are cheat sheets. You can open them up for a focused topical review. And because you've asked specifically about prioritization, let's take a look at that, because this is a very good question. Who asked this? KP Nahal. Very good question. So you're right. It's not always going to be as obvious as, they're not going to say, which patient do you prioritize? Somebody with an airway issue, somebody with a circulation issue, right? You have to be able to kind of read between the lines and know what each of these things look like. And so based on our extensive research, we have assembled this NCLEX Bootcamp prioritization pyramid where your first priorities are always going to be airway or safety. And the good news is the NCLEX is never going to ask you to choose between somebody with a safety issue and an airway issue. So if you see one of those, that's going to be the correct answer. And then if you don't have anybody with an airway or safety issue, really, then that's when you break down into breathing, circulation, and we go beyond the ABCs. Disability, so anything neurological, low blood sugar, stroke symptoms, pupil changes, confusion. And then, of course, our lowest priority are going to be stable chronic issues, things that are routine, expected, or psychosocial needs, like the teaching and the Mohs surgery in the previous question, right? So the key then is being able to recognize when an issue is an airway issue, a breathing issue, and so on. And so we've also compiled some of these common warning signs on the NCLEX. Because when you are getting passing level questions, when you are doing really well on your NCLEX, as we know you will, and you're answering these really challenging questions, it's going to be less and less obvious when something looks like a breathing issue or a circulation issue. And so the NCLEX likes to give you these very subtle warning signs. So for example, drooling. Like drooling doesn't sound like an airway issue, but it is, right? Because this could indicate epiglottitis. Or in the case of an inhalation injury, if the NCLEX gives you an option and says the they cough up some soot-tinged sputum, that should be something that you recognize as an airway issue if you know your content. Things like restlessness. They love to give you restlessness as a finding of a breathing issue. So unless it's somebody who would who that would be an expected finding, like maybe a client who is in the manic phase of bipolar and they're agitated and restless, that would be expected. But if somebody has heart failure and they're coughing and restless, that should make you think this is a breathing issue, right? So there's the two things. It's being trained to recognize what problems are problems of safety, airway, breathing, and so on, and being able to decide, is this an airway and safety issue, or go down from there. So it doesn't just stop at the ABCs, you're right. And NCLEX or nursing professors like to kind of try and make it that simple, but I could have a expected abnormal. Like I could have a 90% pulse oximetry with COPD, and that's not really a breathing problem because it's a stable chronic issue. So it's not as simple as the ABCs, and we try and break this down for you here. So again, really, really good question, you guys. All right. Yes, good, Sen. Very good. All right. Epiglottitis. Good. Okay. Does that make sense to everybody? Anybody have any more questions before we move on? Swollen. Yep. Very good. Swollen throat will cause drooling, which is ABC. Awesome. All right. Cheryl wants some EKG questions. All right. Next question from Vicky Smiles. I like your name, Vicky. So she says, please help us with tips on identifying the right answers on NCLEX questions. For example, when you see a certain phrase, how will it help you know if it's the right or wrong answer? Okay, so I think you're asking about test taking strategies. And this is kind of the difference between the old NCLEX and the new next-gen NCLEX, is a lot of these tricks, like phrases that should give something away as being right or wrong, they aren't as useful anymore because the exam is really asking you to call on your knowledge of the content and your ability to critically think. So I'm going to give you a couple answers to your question, but I would first say that rather than focus on trying to memorize phrases that give away the right or wrong answer, I would spend more time kind of focusing on making sure that you understand the content. And I would say if you're answering questions in the bank and you're reviewing your performance and you're realizing that you keep missing questions, let's say in the example of a prioritization question, maybe you keep choosing distractors that say somebody has dyspnea on exertion. You missed kind of the qualifier there. It's not dyspnea at rest, which would be concerning, but dyspnea on exertion. And actually, this next page of this prioritization cheat sheet will give you some examples of that. So here you can kind of see, same idea, pink frothy sputum. We've got a client with CHF, a client with CHF. CHF on its own, in isolation, it's just a circulation issue. But if we've got pink frothy sputum, that's an unexpected finding versus peripheral edema, which is an expected finding. So just making sure, I would say, that you're not looking for one word or one phrase, but instead considering the whole answer, the whole patient, the entire patient situation, kind of stepping back instead of focusing on individual phrases or words and just trying to think, what do they look like? And so we've also given you some examples here on the final page to give you some practice with that. So, I've got a full scenario here, sudden anxiety, and I've got a pulse oximetry reading of 80%. So we want to think about these things together, right? So you want to kind of consider the whole patient picture at once instead of just looking for specific phrases. So excellent question. Okay, yes. Somebody says test taking strategies is key. Eliminate the wrong answers first. Definitely. You don't want to focus on trying to prioritize any patient that has stable or chronic issues. If it's a stable breathing issue, you don't need to think about it. If it's a stable circulation issue, you don't need to think about it. So eliminate those stable chronic issues first and focus on the unstable or acute problems that remain. Excellent. Okay, so we've got a question that several students have asked about knowing when to study content versus answer practice questions. What would you recommend? And is answering questions and reading rationales practicing content? So, yes, it's going to depend on your foundation of content, I'll say, and it's going to be a little bit of both. You want to kind of practice going back and forth between the two. And if you look at our study guide, you can see that after you take a readiness test and review which areas are weak, then you're going to do practice questions here, reading rationales as you go. And then this is really where your learning takes place, is when you review those rationales and then take some time to go back and repeat your missed items. Because the important thing is that you know how to answer these questions. You know this content in the context of an NCLEX question, right? So if I just memorize everything about one disease process, that doesn't necessarily help me answer questions. So I would recommend, have kind of a focused content review built in before you go try to apply that knowledge on in a question bank. And then after you've answered the question, so let me give you an example. All right, so, so nephrolithiasis. So let's say I've just reviewed my renal and urinary section, and at this point, I've got a good understanding of the different renal and GU findings. Now I've come to the bank, I'm answering questions on renal and urinary questions, I'm applying my knowledge, and then that is going to help me identify my gaps in my knowledge. If I sit down and I have a good foundation of this and I try and answer these questions, flank pain radiating to the groin, pain in the lower right abdomen, maybe I know a couple of these because I've just studied this and it's fresh, but let's say, I think, I don't know this word, I think it's the term for a UTI, and then I pick this one because I know that's what a UTI looks like, but then I would miss it because this is actually a finding of the UTI. So this is going to help me brush up on not only my findings of nephrolithiasis, but clarify any terms or confusions. So that's what I would recommend. I would recommend kind of building in this alternating content review, reviewing what you'd learned in nursing school, using our cheat sheets for that, and then doing a focused session answering questions on that content area in the bank, because that's going to immediately call out for you what you failed to learn when you tried to refresh your memory with a content review. And then at the end of the week, when we have those built-in days for reviewing your missed items, you can actually create a test here from your learning items, which is ones you answered incorrectly, or reviewing items, which is something you got partial credit on. So I can say I want to go in here and I only want to review the, maternal. Let me do maternal since that's my weak area. So if I want to focus my study, let's say I just reviewed something on placenta previa and abruption, because I did. I literally just recently reviewed that content. So when I'm coming in here to answer these questions, it's going to be immediately obvious to me if I missed something from my review. So, all right. Other questions? Okay, I see that it looks like most of our questions here have been answered. So let's move on to the second part of our presentation here, which is how do I know when I'm ready to take the NCLEX? And this is a tough one because I think we all want to feel really, really confident before we go into our test that like, I've got this, I'm ready for it. But those of you who have taken the NCLEX before, or your classmates have, or the cohort before you has, probably everyone came out saying that they feel like they failed, right? It's really uncommon. If you did go into the test and you know that you just nailed it and answered almost everything correctly, good for you. But the way that the NCLEX works, it's an adaptive test. So the better you're doing, the more questions you're answering correctly, the harder and harder the questions are that you're going to get. So whether you sat down to take the test or whether I sat down to take the test, each question it gives us is going to be one that the CAT algorithm thinks we have a 50% chance of answering correctly. So my questions will be harder than yours most likely, but we're both going to walk out feeling like I didn't know anything on the test. And that's actually a good sign. So just that little note on readiness is you're probably never going to feel fully prepared. And that's why we have in our bank a lot of very challenging passing level and above questions for you, so you can get comfortable answering these complex questions. It's not going to do you any favors if you just practice answering easy softball questions. It'll make you feel good about yourself, but then when you actually sit down to take the test, you aren't prepared to answer those passing level questions. But ultimately, the answer is kind of only you are going to know if you're ready. But to help guide your remediation, we've given you a couple of ways to know that. So first, whether you've met both of the NCLEX Bootcamp targets. And so within the product here, you are going to have your performance page, and you're going to see these little green check marks, and you'll be told if you've met the targets. And so this has been studied. Actually, they've done a lot of studies where they've looked at what correlates with passing standardized tests. And almost every time it's the more questions you complete, the more likely you are to pass. And that's just because we know practice makes perfect, right? So we want to make sure that you have answered this is according to how other users are using the bank, the average number of questions answered, and the average score, because this is how the NCLEX determines passing it's kind of at a cutoff based on how everyone's performing. And so that means if you've answered at least 1,122 questions, and then your average score is 61%. So I've met both of these targets. If you meet both of these targets, 99% of students who meet these targets pass the NCLEX. So you are very likely to pass if you have answered enough questions and scored high enough overall on your average score. And so if you have not met one of these two targets, so for example, if you haven't tagged or answered enough questions, that means you just need to go on answering questions. If your score is low, your percent performance is low, then you want to go remediate some of those items by answering your learning questions or your reviewing questions and mastering that content that you've missed. And then we also recommend that make sure you want to meet those in all of these subjects. So even though I've met both of my targets overall, and I wanted to practice more, I need to go answer some more fundamentals questions in order to make sure I'm ready to answer those safety and infection control, basic care and comfort questions. I need to answer more mental health questions and management of care questions. So that kind of helps you know if you're ready or not, is have I met both of these targets? The other ways that you can know if you're ready is by your results on these readiness exams. And so these are based not only on your performance overall, but your performance in each of the subject areas. And let me see. So that if you look at our study schedule here, we make sure that you take a readiness assessment up front, and then you have a week of practice of reviewing your weak areas and missed items. And then you take another readiness assessment, and then you do the same thing for a week. And so you kind of do this is your practice routine. I take a readiness assessment, I see where I'm at, and I see where my weak areas are. I answer questions and cases, reading the rationales, watching the videos, learning and brushing up mostly in my weak areas in these subjects, and then I take another readiness assessment. And so ideally, you want to see your performance improving from week to week. So when I'm here looking at my readiness scores, let's say the first week I get a low chance of passing. I've been out of school for a while maybe, and I didn't study at all. I just jumped right in. That wouldn't be unexpected. I have a low chance of passing, but then you want to make sure that maybe the next week you have a borderline chance, then a high chance, then a very high chance. You can also reset and repeat these as well to just kind of keep assessing your progress as you go. And that's what makes practice, perfect practice, is that feedback piece, that evaluation piece being built in. So make sure that you keep taking these readiness assessments as you go. So yeah, you'll know you're ready if you've met both targets, and then you have a very high chance of passing on the readiness assessments. If you don't, then I just showed you how to get there, either by answering more questions or repeating your missed areas or focusing your review on your weak areas so that you can have that high or very high chance of passing. All right, so I'm going to take some questions related to readiness. All right, Eki Louise said, what do you recommend to do the final week of preparation? Okay, so that's a really good question. It depends on how long you've been studying, right? Because if you only have 1 month to study, if you're trying to cram all this in, then you probably want to take a little time to rest, do easy review. What I wouldn't try to do is learn the heaviest, most critical information in your final week. Here in our 1 month schedule, really at the point that you're answering management questions, so when you're answering questions on prioritization, you're going to be prioritizing between adult clients where you learned about their diseases already, maternity clients where you learned about their diseases already, and so you're really just applying information you already learned instead of learning something brand new. So I wouldn't wait until the last minute. And I would definitely at least give yourself a day or two of rest before the exam, because at this point, it's like you're ready or you aren't, right? And so give yourself a day or two, and we've built any necessary rest or easy review days into these schedules to help make sure that you aren't overwhelming yourself and stringing yourself out, and that you're really well rested and your mind is sharp and ready to answer questions on test day. So very good. Okay, I'm going to go ahead and go on to our final section here if you guys want to drop some more questions in. So what should I do if I receive a low chance of passing on my readiness assessments or have previously failed the NCLEX? And so I'll say this, a low chance of passing on your readiness assessment does not mean you are going to fail. It just means that you have a little bit more review to do. And like we said, so if I look at my low score here, it tells me that my weakest areas are, again, maternal health and pharmacology. So we tell you here, if you get a low chance, this is what you need to do. You need to go practice questions from these sections, read your explanations carefully, and then repeat those readiness assessments and watch to improve. As far as if you have failed the NCLEX already, well, if you fail the NCLEX, they're going to send you something called a candidate performance report, or a CPR, which is, I think, an unfortunate name. But if you get a CPR, they're actually going to show you whether you were below, near, or above the passing standard in each of these areas. And so each of these areas is going to correspond to a different subject in our test bank. So let's say you took the exam and you got on your candidate performance report that you were near the passing level in everything, but or above the passing level in everything, but way below the passing level in farm, or near the passing level, but not above the passing level in clinical judgment. So that would mean that when you are remediating yourself before your next NCLEX attempt, you want to focus your questions from our pharmacology section and from the NGN case studies. And this is where clinical judgment is going to be tested on the NCLEX, and that makes up more questions on the NCLEX than anything else. So if you've got 3 full-length case studies on a minimum length exam, that's about 25% of your test. That's a big chunk of the test. And so being able to look at your candidate performance report, saying, I scored low in clinical judgment, and then focusing your remediation on just the NGN case study. So when I make my test, I am working specifically on these case studies, and then within these case studies, making sure, like we talked about, that you're handling the rationales in a way that allows you to learn what you missed, why you missed it, why you got it right, what each of the options was supposed to be teaching you, or what you were supposed to be seeing or thinking about. And then our videos in this is really, really helpful. Is really helpful for you to understand what thinking should have been behind that. So excellent. All right. Okay, Vicky Smiles has some good advice, says don't beat yourself up. Yeah, don't beat yourself up if you do poorly. And I agree. Remember, the NCLEX is a very challenging test, and everyone who passed is still getting about 50% of the questions right. So it is normal to feel challenging. Don't let it feel, don't feel defeated when you answer questions incorrectly. You can miss 50% of the questions on the NCLEX and still pass. So keep that in mind. I think that's great advice. All right. Okay, so I think that's all of our questions. I think we got everybody's questions answered. We just talked about the candidate performance report. Okay, so one student asked about the candidate performance report. What does evaluating outcomes mean? So great question. So this clinical judgment section is broken down on your candidate performance report into each of the clinical judgment areas. And you can actually learn more information about that in our Next Gen course. And so let's see. Within each of the NCLEX case studies, you've got these 6 steps, and that corresponds one step to one question. So recognizing cues, analyzing cues, and so on. This is basically the nursing process. And so if your candidate performance report said that you were below the passing standard in evaluating outcomes, that means that you need to, I would say, go review specifically in our strategy course how to approach a case on evaluating outcomes and get a lot of practice from the case study section of our question bank. So, all right. Very good. All right, everyone, thanks so much for tuning in. This was a lot of fun. I was happy to be able to answer some of your questions, and hopefully you have a better idea and feel more confident going forward. So just big takeaways. Remember, make sure that you're focusing your study, follow the study schedule, follow the study guide, take it one day at a time, review your missed and weak areas, and make sure that you're not letting yourself feel defeated by answering poorly, and you're just kind of leaning into these performance tab results in order to know whether you're ready or not, and then just take a deep breath and know that you've practiced and you've learned all this content and you are good to go. So remember to check out we're leaving a link for a discount code, a 10% discount for you guys showing up today, as well as a link to download all of our cheat sheets for free, even if you are not a current NCLEX Bootcamp subscriber, although we hope that you will be, because we're confident that we can help you pass and apply these principles we talked about today. So thank you so much, everyone, and have a great rest of your day.